Mama and Papa Bears, it's February, which means we have some pretty cool holidays to celebrate and gives us the opportunity to educate ourselves a little more. Hopefully everyone is aware that it is Black History Month. It's also American Heart Month, and then there's what I call the cute holiday, Valentine's Day. So, in honor of Black History Month, I'm choosing to acknowledge, celebrate, and inform you of the gift and legacy that the father of heart surgery, Dr. Daniel Hale Williams, not only the first Black heart surgeon, but the first open heart surgeon that performed the first successful open heart surgery, not just in America, but arguably in the world. I really hate to just say his story because this is his legacy, and although it be a part of history, it still lives on and is providing us amazing medical care today. It's the foundation of what we know about the heart today. So I'll try to just give you a few bullet points, but this story is just amazing. It's absolutely intriguing. So, Dr. Daniel Hale Williams worked as a barber to put himself through medical school at the Chicago Medical College, right here in Chicago, Illinois, that is now known as the Northwestern University Medical School. Due to the wages that he made as a barber being very meager, Dr. Daniel Hale Williams almost gave up his last year of medical school. But thankfully, someone who witnessed Daniel's hard work and tenacity decided to take out a bank loan and help him financially through that last year so that he could afford his room, board, and education. Come on, village. It's almost impossible to do great things alone. It takes a village. In 1883, he graduated from Chicago Medical College and went on to practice and educate himself in the medical field. Dr. Williams also believed in networking. He made vital friendships and connections with very prominent people in the world of health, politics, and business. His medical genius and influence paved the way for him to become part of the Illinois State Medical Board in 1888. Dr. Williams did not keep his success for his own glory. He was still thinking of his people. He understood firsthand that the position he had was beyond rare. He was greatly displeased with the segregation of hospitals. In 1890, Freedman's Hospital in Washington, D.C. was the only Black hospital in America. They had to care for patients wherever they could, including basements and kitchens. There was little to no access to properly trained physicians, nurses, or medications, which led to unsanitary conditions. So in 1891, at age 37, Dr. Williams used his influence to persuade those same powerful people to allow him to open the first integrated hospital in Chicago. He chose the name Provident Hospital. Dr. Daniel Hale Williams was also a very godly man. He chose the name Provident because it means the Lord will provide. Not only was Provident Hospital the first integrated hospital, it was also the first hospital that was owned and managed by Blacks. It wasn't long after the hospital was up and successfully running that Dr. Williams used this opportunity to give access to medical training to students interested in the medical field. He opened the first Black nursing school and later an internship program for physicians at Freedman's Hospital in Washington, D.C., where he was made head of hospital. Just a few years later, in 1893, he performed the first successful open heart surgery on a stab wound victim. Let me just tell you, this could not have been a very easy choice because Dr. Daniel Hale Williams could have lost everything by performing this surgery. To give you greater perspective, in 1893, surgery was not commonly done, let alone open heart surgery. Why, you say? Because any time that they had to perform surgery, 90% of the time, the surgery would cause an infection. Basically, cutting people open exposed them to get bacterial infections faster that would spread quickly, and they didn't have anything like penicillin to fight against these infections. So unfortunately, it would oftentimes lead to death. They did not have x-ray equipment or the machines needed to provide blood transfusions. There were no heart and lung machines to keep blood and oxygen pumping to your vital organs while the surgery was being performed. So if Dr. Williams had lost the patient that he decided to do this open heart surgery on, knowing all of the obstacles that stood in his way, he could have lost everything. Should you decide to dig deeper, there's access to a lot of medical knowledge that shows that he did not take this risk lightly. His decision to take action was well informed and proved that the patient had greater odds of a successful surgery than to choose to do nothing, which would ultimately lead to an immediate death. Let's also acknowledge that this patient was blessed to live another 20 years. So let us proudly honor Dr. Daniel Hale Williams for his intellect, determination, and courage, which caused him to establish the foundation for Black quality health care. Let's continue to build on his foundation. Now, although that bit of history acknowledged both Black History Month and American Heart Month, I also want to shed light on the moms. It's our nature to nurture, and this is one time that nurturing nature really did save a life. I was reading through my news feed and happened upon a story about a Miss Denise Tyler of Maryland who had a heart attack at a PTA meeting. She said she felt a sharp pressing pain in her chest, discomfort in her throat, and her water tasted salty, which was very unusual. But that pain bothered her, and she wondered, what is this? But just like most of us moms, she said, well, I'm just going to drive myself home and lay down. This is just me assuming here that perhaps she didn't look well also, and maybe a few of the other moms asked her if she was okay. And that's when she might have shared what was going on. I'm glad she honestly shared what was going on, and I'm so grateful and proud of the moms that looked out for her and insisted on taking her to the hospital. Let's go, Village. Take care of one another. So in honor of American Heart Month, this is my public service announcement. Everyone, not just moms and dads, but everyone, if it does not feel right, get it checked out. You know, when you have that gut instinct or that nagging voice that's telling you something's not right, check it out, please. So it turns out Miss Tyler's symptoms are actually abnormal, but those very symptoms that caused her to have to go to the hospital led to her being diagnosed with SCAD, spontaneous coronary artery dissection. It really does sound terrifying, and what it means is that you're having tears in the blood vessels of the arteries of your heart that can form blood clots that can cause a heart attack, which may lead to open heart surgery or an arrhythmia or sudden cardiac death. So yes, it's terrifying because of the word sudden. I don't even want to think about what would have happened if she had have decided to go home and lay down. Now, thankfully, she's recovering, and usually SCAD, in most cases, can heal itself. But when it can't, I don't know about you, but I know I would not want to risk that sudden word happening to me concerning my heart. Did you know heart attacks are the #1 killer of women, more than all forms of cancer combined? So, just as a reminder, the normal signs of a heart attack are usually shortness of breath, lightheadedness, pain in the arms or back. But those are normal signs of a heart attack. Please pay attention to the abnormal signs. So to help inform us all a bit more for our safety, the normal symptoms of SCAD are chest pain abdominal pain, neck pain or back pain that radiates or travels, jaw pain, nausea, dizziness, sweating, heartburn, reflux, or indigestion. Severity varies within each person, so listen to your body, everybody. Again, if it's something that doesn't feel right and it's consistent or sudden and highly unusual, please get checked out. Early diagnosis and treatment improves the likelihood of your survival and quality of life. And last but not least, happy Valentine's Day. Whether you celebrated it on the 14th, before or after, love on all your loved ones. Let them love on you. We all could use a little more TLC all year round. All right, Village, that's all for now. Let's talk again soon. And as always, I'm sending you vibes of love and sanity. Your Forever Mama Bear.